I'm going to take off my mask. It has already been, my gloves are clean. This is Milady coming to you live from Family Practice Doctors. You guys, I would love to say it's been a lovely day. It is a lovely day, but there's been so much going on this side of town with COVID-19. I sound exhausted because most of us healthcare providers are exhausted. All I can tell you is that this town has been lit up seriously with COVID-19. What you're hearing on TV is actually underrated, okay? So all we can tell you guys, please, we beg you to use social distancing as been recommended by CDC, in addition to wearing a face cover, a mask at all times, especially when you are in company of other people, okay? The other thing I wanted to tell you guys quickly, many of the laboratories no longer have, they're running out of the COVID-19 test, the one that tells you whether the virus is in your body. So many of those tests are really available for the hospital setting. So for now, what we have had to do, many of the offices have had to do, is to obtain the rapid COVID test. That means within about 15 minutes, we run the test through a machine, which is a Sophia machine, and it tells you whether you have the virus, whether the virus is in you or not. Now, if you need to find out whether you have antibodies to the virus, that it does go through the lab where we get your blood and we send that out. So I'm just gonna show you pretty quickly without really using the swab for myself, because I am about to test somebody in a few minutes. So this is what the swab looks like, okay? It's a nasal swab and it goes into your nose. Initially, we have you just blow your nose so that the mucus can come down, and then we swab each side of the nose, sometimes just one. We just need the boogies, and then we transfer that into a media. And once we transfer it in, we put it onto a cassette. It gets transferred in here. We put some fluid in. Like a little science experiment. And then once the sample's on here, we put it in here, let it sit for about a minute, and then we run it onto this cassette. And then we squeeze whatever was in here with a pipette. And then it gets on here. Then we enter it into this machine, okay? I'm not gonna come any closer to the machine because you can tell, I'm gonna actually shoot a picture onto social media that shows you this is a negative, this is what a positive looks like, because we have to actually put patients' names on there for HIPAA. We cannot show you the actual machine and what it looks like. But again, this is how quick it is. Within about 15 minutes, you get your results. Having said that, you can call the office at 281-570-2606 for further information. Now, you can obtain tests through Harris County Health, but please know that there is an extremely long wait. And right now, the tests that are through the lab, the ones that are currently running for the actual virus, to test for the virus, the nasal swab, the turnaround time is getting longer and longer because we're testing more and more people. But again, more and more people are coming back positive. So this is not a joke, you guys. This is extremely serious. More and more people are getting infected and more people are going into the hospital. So we implore you to please follow those guidelines. This is extremely serious. Please help us help you, help us help our neighbors, help us help your grandparents, your parents, and even some of the young kids, okay? Those who are going out, please think of your parents and the people in your families that may not have these strong immune systems that you have, where you may have just a light cold, just a sneeze, just a sniffle, but someone else may succumb to this virus. So we as a community need to help each other so that this can blow over swiftly. It's not going to unless we all do this together. There is no color in this thing. There is no creed in this thing. There is no money in this thing. It does not know any of that. We all need to do this together. I pray to God that this really blows over fairly fast, but we need to all do this. Thank you, everybody, and God bless you.